Well, so babies who go through those physical signs of withdrawal, they typically have many of those signs even after they go home from the hospital. It's just that they are lessening in severity and that the baby has gotten to the point where he can now go home and slowly resolve those symptoms because he's eating adequately and sleeping enough that he's going to go home and thrive. So that central nervous system irritability that we mentioned before, that can last for several months, okay? And that's going to gradually improve. Before they're born, when they're exposed to opiates, oftentimes they have what we call intrauterine growth retardation, which means that they're born lighter than they would normally be. They weigh less. And so after birth, those babies typically reverse that and have a normal rate of growth. So that's good. They can, it's hard to do outcome studies on babies because there's a lot of selection bias here in that, in truth, the greatest predictor of long-term outcome in individuals in our culture is based upon socioeconomic status. And so we don't have the full, when folks are addicted to opiates, they tend to drift towards lower socioeconomic status. And if they have felony convictions prior to getting treatment, then that's a long-term detriment to their employability and their socioeconomic development. So these children tend to grow up in less beneficial socioeconomic statuses. And so it's hard to separate some of the problems of outcome from the socioeconomic determinants from the drug exposure determinants. Very hard to separate. I think that when people look at this group, there tends to be an increased incidence of short attention span and hyperactivity as you move from toddlerhood into young childhood. And there have not been studies showing deficits in cognition in older children or deficits in achievement in older children. But once again, those are really extraordinarily difficult studies to do to be able to control for all the other parameters that can dictate outcome. And I think that it wouldn't be surprising if there could be some effect for some individuals in those areas, but certainly we can't document that.